I'm Dr. Showkat. I'm from Channel 19 TV from London studio. I welcome you, everyone. I think some countries is midnight, nearly midnight. In Bangladesh is 10 p.m. at night, and in USA is mid noon. I think is early afternoon. So I think in Canada is also midday. So and obviously the time we have picked to do this live show just to share our help, and our guests will share their advice, and that's how we will try to help the people with COVID problems. How could you help you better, and how actually we could engage people with this COVID problem. So every program we try to invite some specialists in the area so they can advise the right advice and proper advice. Because with COVID era, people are actually bombarded with messages from like social media, different kind of messages, and people are actually more confused and because of bombarded with information. So, and today we have a guest who is a very, very renowned cardiologist here in the UK and around the world. And I'm introducing our guest today, Dr. Resham Baruah. Hello, Dr. Resham. Hi, Resham.
Hi,
Hi.
Monjur. Thank you for having me.
Yeah, thank you very much for joining us. It's a Channel 19 TV show, and it's a great pleasure to have you with us today. Resham is a consultant cardiologist at Chelsea and Westminster Hospital, and she is also a panel member for British NICE heart failure guidance, heart failure management guideline. And not only her works has expanded not only in the UK, expanded throughout the world, and because she's so keen to help people, always time whenever she may find some spare time, try to help people, engage people, share her experience with the people. And in addition to that, Resham has got passion for like see our next generation become brighter, and she's a governor of a school in London. So Resham, so let's start. Like I tell you something about our viewers. Our viewers, Bangladesh, and I'm telling viewers, unfortunately, we'll conduct this program in English. So my proper apologies to our viewers. But what one thing I can tell you, one thing, Resham loves Bangladesh. She loves Bangla. She loves Bangladesh and viewers of Bangladesh, and she had got some experience with Bangladeshi doctors. Can you tell me what happened to, how did you get experience with Bangladeshi doctors?
Oh, Monjur, I was so blown away. You were kind enough to invite me to Dakar, and it was an amazing experience. We met with so many people with so much experience, and actually I learned, I think, far more from you guys than I was possibly able to tell you guys about or inform your conversation, because in many ways Dakar is ahead of the curve and ahead of where we are in the UK, particularly when it comes to heart failure, which, as you know, I'm passionate about. And then, my goodness, the welcome that we received, the hospitality that we received, and the insights that we gained. I can't wait for my return visit. So hopefully that
Actually,
will
Risham,
be
you mentioned
penciled in.
so many generous words. Actually, the credit goes to the university, BSMMU, Professor Shajal Banerjee, Professor Ali Hassan, Professor Harisulok, Professor Dr. Nilufar, and Professor, I forgot few others names. So they are actually so kind, and it was a fantastic day. I think that actually drove you more to do something to Bangladesh for helping the heart failure patient. And I think probably this is one of the reasons you, when I invited you, do you think it is one of the reasons you appeared this show today? Because I know you're very busy today, and especially in COVID era, right? Because in the hospital, and the hospital in Chelsea Westminster is quite a busy hospital in the heart of London, and they were quite engaged with treating COVID patients. And that was actually a wonderful experience from our other friends, and also doctors from Bangladesh. I think that visit create a channel for working together. And what do you think? Do
Absolutely.
you have
And
any
it's
kind
it's
of
it's very much a two-way thing. You know, we have as much to learn from you guys as we can perhaps teach you about what we're doing. So, you know, that experience is valuable, I think, for all
Okay,
parties.
so you mentioned something. This is just sharing experience. Uh, Tell me something about when you started in second week of March when the COVID became a big problem in the UK. How did you start managing your patient in Sierra West Hospital?
So
What kind of thing?
I think we all looked upon the images, particularly coming out of Italy and Madrid in Spain towards the end of February, beginning of March, and I think that many of us had a sense of foreboding that that we were likely to be next, and as you know, the mean age of presentation for heart failure patients is 78. And as early as February, we were getting data from Wuhan to suggest that patients with cardiovascular risk factors were particularly at risk from COVID as well. So the very first thing that that I think we had to resolve was, you know, first do no harm. You know, that is our job
Okay.
as physicians, to first do no harm. And so it was really important to try and get away from the face-to-face contacts with patients wherever possible and move to telephone or video link contacts, particularly for the elderly, frail patients who we felt were particularly vulnerable to COVID. So it was there at the very early stages. It was risk assessment and deciding who do we need to see and when do we need to see them and what format can we manage them in. Can we manage people remotely and save them coming to the hospital and potentially being exposed?
That's a wonderful experience because I think probably that kind of experience the doctors in Bangladesh currently they are facing. You probably heard lots of doctors in Bangladesh sadly died because of COVID infection from COVID. So can we go to the screen? Let's see some data from like statistics from Washington Post. What we could see, this is actually published in April this year. And coronavirus kills more than most other causes, not every causes. COVID-19 killed more people from April 6 to April 12 than any other causes of death except heart disease typically does in not normal uh, April week. So even see, like even in like COVID was like the most dangerous disease and it takes so many lives. Still, heart disease in the USA on that week is the number one causes for death in the United States. So let's focus on COVID. Like you mentioned something when things started in Wuhan, China, got to know that people with underlying heart condition are at risk than with somebody with a normal health. Why do you think this is particularly in people with underlying heart condition have higher risk than normal people?
So I think, as with everything with COVID, you know, data are emerging and our understanding is increasing over time. But if you imagine the virus is trying to get into the body via a door, a receptor on every cell. That door is the ACE2 receptor that people are hearing so much about. And that is a receptor that's not just there in terms of the lung tissue, but is expressed in lots of other places like blood vessels and is mechanistic in conditions such as hypertension. And we know that if you have the more sort of conditions you have, the more vulnerable you are to COVID. And we know that as one ages, the risk of cardiovascular disease increases. And so I think that mechanistically, it's probably to do with the receptor. I think that from the data, a lot of the data have all just been lumped together. So all cardiovascular disease, whether that is coronary disease or high blood pressure, hypertension or heart failure. It's all been
Or
kind of
heart muscle
lumped under
disease.
one umbrella. Exactly, exactly. So um, we, at the moment we have lots of questions, but maybe not so many answers. And the other question is, okay, so people at cardiovascular disease seem to be at higher risk, but what can we do about this? How do we mitigate
Yeah,
that risk
that
for those people?
that's a very interesting, because obviously that's as a physician, your job or my job is they are in higher risk. How could you deal with that? So what you did with heart failure patient in particular, because you're patient for, like, you're not only consultant cardiologist, you also leading the heart failure service in West Hospital.
Yeah, so first thing was anyone that didn't need to be seen face to face, we moved to telephone visits. We encouraged all our patients to get blood pressure monitors and weighing scales, because this is about self-management, and the best way to protect them from coronavirus is that they should not get exposed in the first place. So it was somewhat against the government advice, but to my patients I was saying, please try and shield yourselves, please do not go out wherever possible. The one sort of caveat there is that I think that exercise in heart failure is important. So if it's possible for people to go for a walk, I've been encouraging them to do
Okay.
that, but minimizing social contact, and then continuing with all their heart failure medications, in particular their prognostic medications, so the medicines that are going to keep them alive and well for longer. We wanted to maximize the benefit that they were getting from that, so making sure people were on the right medications, and that if they were tolerating them, that they kept going with those medications.
Resham, you mentioned something about, particularly mention about exercise. But when the lockdown started, like, people were very, very scared to go outside the house because with the fear that they might get infected with coronavirus. Do you think that coronavirus can travel in the air or any kind of airborne disease? Like, that's the reason one of the people, lots of people from Bangladesh, normally ask me, can we go outside when the COVID is so, like, infectious? So for what? Obviously, if
So
somebody go for
I
exercise,
think that if you are able to go out and exercise and go for a long walk and not interact with other human beings, I think that that is safe,
that
and
means
that the
you
benefit
that's
that
you mentioned. You try to say it's a 2 meter distance. If they can keep two
yes,
meter distance,
yeah,
okay,
yeah.
that's actually very good to
Um,
do, because lots of people. Go on, please. Go
No,
on.
but what I was going to say is that it's very possible to exercise within the home. So for those people that are very anxious about going out, I think that it's possible to do, even if you have very limited mobility and you're very frail, it's possible to do exercise just sat in a chair. So I think I would encourage everybody to look for the opportunities and to frame exercise as just movement of any description. So if you are sat at home and you are unable to leave the house or unwilling to leave the house, you can grab anything you have to hand. So what have I got? I've got Vicks, but you could grab a tin of beans and just make sure you're moving your arm. I don't know if you can see, but whilst you're
Yeah,
watching
I can
TV,
also
these
show.
sorts
I
of
can also show that.
movements,
Yeah, yeah,
yeah, these sorts of movements repeatedly, they build up that muscle strength. It's so important. So even if it's not, if you're not able to go for a 1 hour walk, that's okay. If you have stairs in your home, maybe you could go up and down the stairs. If you don't have stairs, you can do shuttles from one room to another room till the point of breathlessness. And the benefits of this are huge, not just for the heart, but also for the rest of your muscles, and for your mind as well. Because I think that one of the big problems that people have faced during coronavirus is the anxiety, the depression, the loneliness.
yeah.
And so even
I,
just
I,
any small maneuvers could be helpful.
I think you have actually suggested and advised few very simple things. Like if somebody is really scared, like do not go to outside and go to the park. Even like if somebody have got stairs at home or apartment, like they can go upstairs, downstairs, and then they can move. Like even like doing some maneuvering, so moving hands, maybe holding something. This kind of if anything is better, in fact, any kind of physical movement activities, it helps. So
Any
so
movement
I know you are
whatsoever. And if, sorry, Monjur, if that
go on.
movement brings the person joy, then that's even better. So, it doesn't matter if you want to put on your favorite music and dance, that's great.
Yeah.
Or there are so many workouts available on YouTube that don't require any equipment and are perfectly catered to people that are more sedentary. So there's lots of different opportunities. It doesn't have to be a big exercise program, and it can just be a little bit. We say 20 minutes 3 times a week.
So 20 minutes 3 times. So how it gonna help if somebody is start from today, just like become very motivated from our show, and how it would benefit them, in which way
Wouldn't that
if they
be
work for.
wonderful? So I think, immediately they may feel energized, actually. And over time, as they see the progression, as they feel that they are building in strength, they may find that their breathlessness decreases. If you can get your legs moving, then people who have swelling find that that goes down. And I think that people who exercise tell me that they feel the endorphins, they feel happier as a result of exercising. In terms of their heart, we find that actually their function seems to help with heart disease, and building the rest of the body up, maximizing the capacity of the lungs and of the muscles as well as the heart is so beneficial. So the benefits of exercise are almost unlimited, and they span every sphere. So people may find that their joint pain is better as they use their muscles more, their breathlessness improves, their mood improves. So, as I
And
say,
also
please
at the
don't be
same time,
intimidated.
yeah, also
What's
at the
that?
same time, like if somebody is a diabetic, like this kind of movement can actually lower the risk for their blood clot. So I think
Absolutely. And
it's really.
also, if you lose weight, then you can potentially even reverse the diabetes. I mean, there is the potential for diabetes to be reversible, but that does take a concerted effort with exercise. So, and diet. So I think that it's important to find something that is achievable, that you're going to stick with, and most of all that you enjoy, because if you don't enjoy it, you're not going to carry on doing it. It's hard to stay motivated. So find the form of exercise that works for you.
That's very, very good advice, because if you ask something to do but the person is not interested or find difficult to do that kind of exercise, is actually at the end of that, or when you lose your interest doing something, you will not enjoy the thing. So you need to keep your mind cheerful. And that's also if you are cheerful and then you actually enjoy your time, and it can boost up your immune system actually. So stress actually put a
Absolutely.
lot of, and so you need to keep yourself healthy, your mind cheerful. So like, and now I'm going to, because you are a heart failure specialist, and like we know there are various causes of heart failure. Like people develop heart failure because of like somebody have a heart attack in the past, or somebody develop heart failure because of long extending hypertension, or some people develop a heart failure because of a heart valve problem or heart muscle problem. So which group of patients actually are more risk having the COVID-19 coronavirus infection? Because I know you are a
So
heart failure, so you are leading the
yeah.
country.
So
So that's the reason. It's a very, for a normal cardiologist, they may not answer this question, but I thought it's better to ask you.
Yeah, and so when I was in Bangladesh, I was struck by the majority of the heart failure there, I think, is post heart attack. Um, but also high blood pressure is a really big problem in Bangladesh in particular, and I think that these are the major risk factors. We don't have the data to back that up, but I think that high blood pressure, because of the receptor, that door into the body, um, being how COVID gets into the body, I think that hypertension, so high blood pressure, is the major risk factor here. We also know that patients who are obese seem to be doing particularly badly. They seem to be more prone to getting COVID in the first place, and also more, they then, once they get COVID, they seem to have a worse outcome. And obesity is a complex disease, but is associated with diabetes as well. And we know that diabetic patients have more likely to have heart attacks, and also have an impaired immune system. So, I think for the people who have high blood pressure, this is a risk factor. So what can they do about the high blood pressure? There are some really there are things that we can all do in our lifestyle. So we've talked about exercise, but exercise, particularly if it's associated with weight loss, can cause blood pressure to come down, and can be as effective as medications. It's important for those people who are taking medications to make sure that they do remember to take their medications. And then the big one, and particularly in our culture, is salt in the diet. So it's really important to try and moderate the amount of salt in our diet, to try and keep that blood pressure under control.
So that's a actually very clear message to the viewers. So, like, there are so many causes of a heart problem, and people are actually at risk of COVID problem. So, you mentioned obesity is a very complex process. So, what do you think? How risky if somebody is very obese? Are they at huge risk for having very bad COVID if they get infected? If the obese get infected with
Sadly,
COVID?
yes. Yeah,
That's
sadly,
sadly,
the obese patients, when I worked up on the intensive care unit at Chelsea, and from what we see around the UK, patients who are obese are at much higher risk, and much higher risk of more severe disease. And it's harder to ventilate these patients as well. It's just they seem to be particularly prone because of this condition. So it's very difficult. Obesity itself is complex,
yeah, it
as a
is a very
condition.
complex. It is very complex. Ideally, like for instance, like while watching our program, if somebody is motivated, if obese and motivated to lose weight, what would be the max limit for losing weight a month or a week?
Gosh, I actually don't know what the maximum is, but I think that with anything, if it's going to be successful, it needs to be sustained. And I think that if you are losing a terrific amount of weight very quickly, then I would worry that that's because of changes that you cannot sustain over time. And I think it's much healthier to take a much broader approach, to really have a reflection, a consideration of what has caused you to be how you are at the moment. What are the factors that are playing in? And to consider all the factors, the food that you're putting in your mouth, both the quality of the food that you're putting in your mouth, but also the quantity of the food, and what drives you to eat, which maybe, a lot of people, myself included, eat when we're stressed. Some people eat when they're bored. So lockdown is, in many ways, very
Yeah,
conducive to
but
putting on weight.
It's
And
actually
then the other,
lockdown. Yeah,
go
I
ahead,
think
sorry.
probably we. Sorry for the interruptions. I think probably we'll go for a very short commercial break, just for a couple of minutes. Viewers, those who are watching the show, please stay with us. We'll be back to you after the short commercial break.
রয়্যাল টাইগার নতুন স্মার্ট বোতলে সেই অরিজিনাল টেস্ট আর আনলিমিটেড এনার্জি। রয়্যাল টাইগার। রয়্যাল টাইগার নতুন স্মার্ট বোতলে সেই অরিজিনাল টেস্ট আর আনলিমিটেড এনার্জি। রয়্যাল টাইগার।
Good afternoon, everyone. We're back from our short commercial break. So, viewers, those who are watching this program today, we are not conducting in Bangla, which we normally do, because our guest speaker, Dr. Resham Baruah, she is not Bangla speaking, but she loves Bangladeshis and she loves to help Bangladeshis who have got heart condition, especially those who are suffering with heart failure. So that's the reason she has spared her time to be with Bangladeshi people. I think probably from America, Britain, Ireland, Canada, Australia, and Bangladesh. Lots of people are watching this program. So we start with some questions. Actually, I got a question from a consultant physician working in the NHS. That is a very question for he wanted to know. So he manages every day. Is actually he's leading a corona unit lead. So he wanted to know uh, what is the current consensus of initiating new patients who are AC inhibitor or angiotensin receptor blocker on those on patient newly diagnosed heart failure. So
That's a great
COVID.
question. Really great
He's actually
question.
very clever. He's a very clever patient. He's managing a loss of patient. He's actually leading COVID unit in Belfast.
Oh,
Doctor,
wow.
I
So
actually, he was our guest speaker yesterday. So his name is Nasheed Nur Alam. So he's Bangladeshi origin. So he has asked his
great
question.
question. So heart failure is unfortunately the most deadly disease in cardiology. It is far worse, in fact, than having a heart attack. So if you go into hospital and have a heart attack and survive, the chances in the UK that you die in the following year are 7%. If you go into hospital with an episode of, with a presentation of heart failure, the chances that you will die in that following year are 28%. And so, unfortunately, the prognosis in heart failure is worse than many cancers. So if we find that someone has heart failure, and in particular, if we find that their heart is not pumping well, it is absolutely imperative that we start them on these medications, because we know that with these medications we can potentially prolong life by a factor of 3. We can, with the right combination of medicines, including those ACE inhibitors that your colleague mentioned, that we can improve survival and add years to people's lives. And those years, I think, come with the benefit of actually being good quality years, because unlike the comparator disease, of cancer, where if you have cancer and you take chemotherapy, chemotherapy unfortunately makes you feel worse, but you take it because you want to live longer. With heart failure, we have these medications where you can take the medications and they both make you feel better and make you live longer because they are improving the pumping function of the heart. So it's really important, even amongst the hysteria of COVID, that people who could benefit from these disease prolonging medications get access to them and get started on them as quickly as possible. So that's the real challenge in COVID times, is to identify the people who potentially have this heart problem and get them on the right medications as quickly and as safely as possible, and get them to the maximum possible doses so that they are getting the maximum benefit. And I think that it's really important for viewers to not be so scared of COVID that if they do have a heart condition or they feel that they have a heart condition, to seek medical attention, because we need to be there for our heart patients, so that we can make sure that they are getting the best possible treatment.
Thank you very much for actually clarify there is a consultant's physician's like query. So let's go into some trials. With COVID, there are lots of trials going on around the world. Not many trials results we have got, but one of the trials that's actually draw the attention of the people in the whole world, the recovery trial that's led by University of Oxford. This trial came up last week. The result came up last week. What they have got that with people, those with advanced stage of COVID disease, especially those who are on ventilator, and when they have given dexamethasone is one of the steroid, like one type of steroid. So that helped. Actually, that was the only first life-saving drug from that trial we got to know. So my question to you, now they have got something, because with dexamethasone, with steroid, they can increase blood sugar, they can raise your blood pressure, they can increase retain fluid in your body, and what do you think that with a heart failure patient, is that a good one, good drug, life-saving, or?
So dexamethasone, I mean, kudos to the recovery trial, and they've done an amazing there's been an amazing effort, and I know that we are one of the trial centres, as many centres within the UK are, and this is an excellent trial. And actually the findings of this trial are particularly great for places such as Bangladesh, because dexamethasone is a form of steroid, as you know, and steroids are widely available, have been around for decades, and are very well understood and should be available to patients who need them. That cohort of patients is actually quite small. So that is patients who are requiring oxygen and who are on ventilators, but not for patients in the community with COVID. If you are not bad enough to require oxygen, you probably are not going to benefit from the steroid. And I think that probably when you look at the recovery trial and how it worked in hospitalized patients. The role for steroids is in the inflammatory stage of the COVID disease, and at that point it becomes what is the greatest threat to life. So if I had a heart failure patient who was on the intensive care unit and was ventilated and was in this inflamed stage of the COVID disease, because what we're seeing with COVID is that it is actually a multi-system disorder that is attacking all parts of the body, not just the lungs, then on the basis of the recovery trial, we would be suggesting that that patient should get steroids.
Thank you very much for clarifying, because there is in discussion, like probably you heard about that, one of the antiviral drugs, remdesivir. So, and few weeks ago, like people were a bit obsessed, in some kind of obsessed with giving all COVID patients remdesivir. What do you think about giving patient remdesivir over steroid dexamethasone? What is your opinion?
I think the recovery trial would suggest that actually the benefit is there for the dexamethasone, and therefore that's what we should be guided by. Now, obviously, if more data emerge, then we can maybe revise that opinion. But, you know, as with anything in medicine, get the basics right. Make sure the patient has oxygen. Make sure that we've thought about blood clots, because the problem, one of the many problems with COVID, is that patients become very prone to blood clots. Try and get that fever under control. Make sure that if there are secondary infections, that those are being treated appropriately, and you know, use the evidence guided treatments where we have them, which would include now dexamethasone.
So that is actually that trial, recovery trial, gives us very clear-cut message about starting dexamethasone for people with advanced disease. So Resham, like you did a lot of heart failure patient. We see patient with heart failure symptoms. They look like they've been malnutrited, or they don't look very well, or they do not feel enough strength. When nutrition takes a big role, do you suggest any kind of, do you advise anything about nutrition, people with underlying heart failure or heart condition? What is your advice to the viewers?
So my advice is the same to all my patients, no matter what cardiovascular disease they come to me with, which is that they should eat well. And what does eating well mean? It means eating a good variety of foods, but that they should be predominantly, where possible, including fresh fruit, vegetables, oily fish, oats for lowering cholesterol. But the important thing is to move away from white carbohydrates, which unfortunately includes things like rice, and I'm part Assamese, so I am a big rice eater, so I feel that pain.
Me too.
And
Me too.
breads. Yeah, we you know, we are blessed because we have the best food, the best tasting food, but unfortunately it's not necessarily maybe the best for us. And to try and keep that salt level down, which, you know, if you want to make something taste good, add ghee, add salt, and it tastes good, but unfortunately you pay the price in terms of your body. I think in Bangladesh, I was lucky enough to sample the delicious foods you had, and you're luckier because there's less processed food, and I think people take cooking and eating very seriously. So at least they're using the best ingredients and they're cooking from scratch. In the UK, we lead much more of a lifestyle that is determined by convenience, and a lot of the convenience foods are much more processed, and that's probably, or is definitely overall worse for you. So, you know, take the time in lockdown to really spend time making food from scratch, and try and focus more on the dals and on the subsies, on the vegetables, and less, unfortunately, on the rice and the rotis or chapatis or naans.
Yeah, this is unfortunately, it is very true that, like, among the not only Bangladeshis, South Asian people, like Bangladesh, India, many parts of India, we love to eat plenty of rice. Like, we are not very keen to eat lots of salads and also lots of vegetables, fruits, unfortunately. But when you are hungry and you try to grab food, so rice, because we enjoy that. But what do you advise to take lots of vegetables, fruits? I think viewers, those who are watching this program, make sure that during this COVID crisis, you need to keep yourself healthy. You have got nice advices from Resham. It's not only heart failure patient, is actually that any patient with heart condition or even a healthy person should eat healthy, live healthy. So, and now I'm going to another direction. So, probably you have heard like lots of doctors in Bangladesh sadly died because of COVID infection. I think the number is more than 50. In Bangladesh, only with the government records, only 1,500 people died. Unfortunately, uh, f- among those 1,550 of them are doctors. And if you see the figures here in the UK, like we have got more than 42,000 people died because of COVID, but the NHS workers, including doctors and other healthcare professionals, only died around 200 plus healthcare workers died. If you see the huge number, 42,000, more than 42,000 people died of COVID, and only 200 plus people died in Bangladesh. Among 1,500, 50, more than 50 people already died. Do you think the work placement, like the way of working in Bangladesh, could be a potential trigger? Like not getting enough protection or anything else, do you think? Or they are doing some procedure is not safe enough? Because I know you are
I
involved with
think
designing the service.
so. I mean, you and I are doctors, Monjur, and it is our pleasure and our privilege to serve and to do our job. And I really do believe we are privileged to do the job that we do. However, I think what COVID has done is that it has put healthcare workers at risk in terms of their own lives and in terms of the lives of their families as well. And this has put a lot of psychological strain and pressure on healthcare workers and their families. And these losses of healthcare workers to this disease are tragic. I mean, any death from COVID is tragic, but these losses are particularly tragic for people who are trying to help and who have themselves become victim. I think that we know that people of Bangladeshi origin, South Asians, Black people are more at risk and more susceptible to COVID than Caucasians, looking at the UK data, and the mechanisms behind this in this country are not fully understood, but it's probably multifactorial. I imagine when you look at the healthcare providers in Bangladesh, and in particular the doctors in Bangladesh, many of them are very senior male doctors, which are also a risk factor. But it's really important that if we want to have the best healthcare system that provides the best care to the population, that we protect our workforce, that we give them the adequate protection, and that we also really honestly look around our departments, look to see who we think is at higher risk, and try and make sure that they are less exposed than those of us that may be at less risk. So as I speak as a female doctor, we are at less risk than our male counterparts. Um, and that goes back to, I think, the fact that that ACE2 receptor is expressed on the X chromosome. So women seem to have that additional protection. But I think it's important that we do look around our departments, we make sure that we share the risk, and that those that are thought to be extremely vulnerable are taken out of the workplace. And that might be a very difficult decision for the individual to make. So it might be down to the institution and colleagues to say, look, you need to
Yeah,
sit out
yeah,
and do something more remotely.
that is very interesting things you flagged out during this discussion, that because of X chromosome issues and like female are less risk compared to male doctors. Well, there's also you have suggested that like the policymakers, the hospital, they would need to make this kind of decision, like who are at less risk. And when you have actually started designing the service for cardiac service or heart failure services or your hospital in Chelwas, what are the main issues you looked into when advice you have given to your like junior doctors or the nurses or cardiac physiologists, what kind of advices you have given to?
This. But at the beginning of the process, I think it's really important to bear in mind that I'm not going to ask someone else to do something that I wouldn't be prepared to do myself. So I'm not going to ask any member of my team to put themselves at additional risk. And at the very beginning, it was very important that everybody had their masks tested and made sure that they had a mask, and also that that mask worked. And anyone that didn't have a mask that fit them was not going to be exposed to patients. It was important, I think, from a leadership perspective, to be present and to be visible, and to really think about what I was exposing the team to, and whether that exposure was warranted. So, we made sure that every echo request was vetted by one of the consultants, and we were on site, and that we did the echoes in full PPE from the outset, because for those of you that aren't familiar, echocardiography is an ultrasound of the heart. It is a very involved process. You have to be highly trained to do it, and it involves being next to a patient and in contact with a patient for usually about half an hour. So if that patient happened to have COVID, then that is quite a high risk procedure. And so from the outset, we said that for all echoes, we would expect full personal protective equipment, and by that we went over and above the sort of national guidance, because it had to be enough to make the person doing it comfortable to do it. And we made sure that every request was vetted, so that it was really in everybody's best interest, the patient's best interest, to get that test, and that it was going to add value to that patient's care. And we worked as a team, and we talked through things. And I think it's really important not to hide behind what's going on, and to be honest with your team. So at the outset, we said we're all scared, because we were all scared, and there was
Yes,
fear of the unknown. So we did
that's
it
very true.
together.
Yeah, that's very true. Everyone is scared. Just, it is better to be honest. If you're not feel well, or you think that you might think that procedure might be like, a bit risky, be honest with your senior colleague. I think
Yeah.
probably, do not put yourself at stress, and do not put yourself at risk at the same time. So there are a couple of things, like one questions came up from three like viewers. And actually, I thought to ask about this question, but I got three messages from three viewers, and they asked me, like, somebody with heart failure, acute heart failure symptoms, they develop shortness of breath. And also COVID patient, they also develop shortness of breath if their lungs are involved. How do you how do you differentiate, like when you speak to the patient, or like, which patient to go hospital or which can be isolated? How do you make that decision? It's very,
It's very difficult, isn't it? Because the breathlessness can be part of both syndromes. Both syndromes tend to affect the more elderly. Obviously, with heart failure, if there is previous coronary artery disease, or if someone has had a heart attack, that might point us towards heart failure. Or if they're describing swelling, difficulty lying flat at night, breathlessness, particularly when lying flat, those sorts of symptoms, or shortness of breath that isn't really there at rest, but is more there when they exert themselves, that all is pointing more towards heart failure. With the COVID, obviously temperature, that points away from heart failure. Cough, and that dry cough. With heart failure, it can be a more frothy cough, a wetter sounding cough. And the loss of smell, which is this key new symptom that emerged over the past 2 months or so, seems to be much more likely to be COVID than it is heart failure. But I think the message is, it's very difficult to decipher, and actually it's about making the patients feel comfortable that they can come into the hospital safely, and that we can do a formal assessment, and we can do, you know, chest x-ray, echo, natriuretic peptide tests. We can examine the patient, we can do blood tests that will point us towards one way or the other now.
So thank you very much, Resham. So you mentioned that test, natriuretic peptide, I think, BNP or anti-pro-BNP. And I have seen, and in Bangladesh, because BNP test is very expensive, it costs like 40, 50 pounds per test. So obviously, because of expensive tests, lots of doctors actually do not request to do this test. And what is your opinion about that? Like, if you want to get a confirmed decision whether somebody with heart failure, do you advise still to go on and do a BNP test or do something else?
So in the UK, we use natriuretic peptides as the gatekeeper to echocardiography, to ultrasound of the heart. So ultrasound of the heart, the echo scan, particularly in conjunction with assessment by a cardiologist, is the gold standard for determining heart failure. In the UK, we have big waiting lists for echocardiography. And so we use the BNP, the natriuretic peptide, the pro-BNP, as a gatekeeper, and the cost for us is slightly lower than the cost of an echocardiogram, roughly. And so we use that so that we can rule out heart failure in a subset of the population, and we also use it to determine how quickly we need to do the echocardiogram and the specialist assessment in those who have a raised natriuretic peptide. So if it's markedly raised, an NT-proBNP of over 2000, we would like that assessment within 2 weeks. Everyone has to work within the system in which they operate. So actually, if it is easier and more available for patients in Bangladesh to go straight to that echocardiogram and specialist assessment, and that is available to them, then that would be the quicker and better way of making the diagnosis within that healthcare system. So as long as they can get the echo to see whether the heart is pumping well, whether there is valve disease, that's the main point, because that allows those patients who have got heart failure and whose hearts are pumping less efficiently, who have a reduced ejection fraction, so an inefficient heart, to get on those medications that are life prolonging.
Thank you very much. That's again a very clear message. So I just want to ask you a couple of things. And like, you have studied in London School of Economics. So regarding like cost saving or something about that, can you tell me about what you did when you studied your master's in London School of Economics?
Oh, I'm so lucky, Monjur, because the European Society of Cardiology sponsored me to do this master's program, which I can highly recommend, in health economics and cardiovascular outcomes and management. And it's led by Professor Elias Mosialos, who is an incredible world leader in this field, and I would highly recommend people to look him up and look up the work that he does with the European Observatory, because actually, if you want to see a country that's done well in COVID, look at the Greek response. So the response in Greece, which was a low resource country, and actually they have done very well, and I think it's led by the guidance that they've taken. So what the masters looks at is how you assess interventions, technologies, medications, not just for how effective they are clinically, but also how much value do they add. And the question, all of us work in healthcare systems where the amount of resource we have is finite. It doesn't matter where in the world you are, you have finite resource. During COVID, that resource might be ventilators, or it might be intensive care nurses, or it might be oxygen. But how do we inform the decisions about who gets what? And that's basically what the Masters is about. And it's a fantastic program that is open to all. And I would suggest that everyone should, who's interested, should look it up.
I think that is actually very good information you shared with the viewers, and especially like in any developing countries, like utilizing resources to a maximum level. You know, doctors are like, when you are trained as a doctor, that's kind of one kind of training. But when you did masters, obviously you have developed separate kind of skills in addition to your medicine. So I think unfortunately in like Bangladesh, India, Pakistan, I haven't seen many like clinicians are coming and attending this kind of program, like how to do like this kind of cost analysis courses, how you can actually save your budget, maximizing your resources. Then probably that is one of the good advices. So, and Resham, we are like only a couple of minutes late for the show today. So if I give you 2 minutes, and you are advising Bangladeshi people, those who are having this heart condition and those who are at risk, what is your message in final message through this program today?
In terms of the lives that we're all leading during COVID, it's really important that they protect themselves, so minimize social contact, wear a cloth mask when out, wash their hands frequently, but also, you know, we all have to also live life. And I think that the secondary effects of COVID are also worrying. So it's important to eat well, to exercise, and to try and maintain the social contact. Even if it can't be face to face, then do the family Zooms, do the video calls. And if you have a concern about your heart condition, if you are getting symptoms, it's also really important to seek medical advice, because you know, COVID is not the only threat out there, that we should take heart disease seriously, and that if there is any deterioration in symptoms, please contact your service, your physician, your healthcare worker, because there is a lot that we can do and that we should do even in the COVID era.
Thank you very much. Viewers, you have got lots of advices, tips, how to keep yourself healthy, or how you could actually prevent getting infection from a COVID-19 coronavirus from Dr. Resham Baruah. And she loves Bangladesh. We hope like we will visit or we'll do something again together, not only TV program. What she will actually, she's encouraging me all the time. Monjur, can we do something together whether we can help to develop the system, which, you know, you mentioned during the show, heart failure patients are actually is much worse than a cancer patient. I think doctors or the policymakers in Bangladesh, and they need to think about that. They need to actually collaborate with the people, those who know how to develop the service. And I'm thanking again from Bangladeshis that spare your time to be with us. And we hope that I have got lots of messages already that can you invite her again, please? If we invite you again, what do you think? Can you manage time again for the Bangladeshi people? If we invite
I'd
you.
be delighted. Absolutely
Thank you.
delighted. Thank you so much for having me. And I look forward to coming back to Bangladesh.
Thank you very much. Viewers, I'm talking in Bangla now, so this চ্যানেল 19 এর হেল্প আজকে এখানেই সমাপ্তি। আপনাদের সাথে আবার দেখা হবে আমাদের পরবর্তী অনুষ্ঠানে। আপনারা সবাই ভালো থাকুন, সবাই সুস্থ থাকুন, দেখা হবে আগামী অনুষ্ঠানে। থ্যাংক ইউ রেশাম।
থ্যাংক ইউ।